We have three themes. So Jean Bourbeau, my program co-chair, and myself sat down and actually thought a fair amount about this. And so what we decided to focus this meeting on was we wanted to maintain a global and international focus, obviously Montreal being a very cosmopolitan and international city. We wanted to make sure that we had ample representation of topics and content that would be relevant to attendees from all over the world. We also wanted to focus our theme on team-based medicine, understanding that in 2015 nobody practices state-of-the-art healthcare in a vacuum. We all practice as part of an integrated team. And so as a result of that, we've tried to put together sessions that are relevant to a broad range of disciplines who practice chest medicine in its many forms, and diversify our content in ways that would have appeal for both physician and non-physician members of our organization. And then the third thing that we have spent I think a fair amount of effort and very successfully with is trying to again advance efforts that CHEST has been doing really for the past 7 years in terms of providing a more customized, learner-centered approach to the delivery of our content. We know that everybody learns different ways, and so what we've tried to do is to continue to diversify the offerings that we have here so that everybody has something offered in a way that they are most effective at learning from, absorbing, and taking those messages back to their home institutions and implementing them. So the interdisciplinary program that we have is actually sort of the biggest new step that we've taken this year to build on that long-standing theme. So when we talk about CHEST, the population of attendees that we focus on in terms of our content, you're right, are a diverse group of people, but they all have overlapping interests. So pulmonary critical care and sleep are kind of the core content areas, the so-called pillars that we have in our strategic vision as an organization. But the reality is, every day we have regular interactions and co-manage patients with cardiologists, cardiothoracic surgeons. We have a strong representation from our pediatric pulmonary community here as well. Not to mention respiratory therapists, nurse practitioners, and critical care nurses. And the reality is that I don't think this is necessarily unique to the practice that chest physicians engage in, but it's especially important, especially when it comes to ICU care, or for that matter, management of patients in the bronchoscopy suite or the sleep lab, that we have a well-trained interprofessional or interdisciplinary team, because that's the only way to take good care of the patient. There's so many important things that are coming out this conference. I'm sure to give short shrift to something. So the scleroderma lung study 2, the initial results of that study is being presented, I believe, today by Dr. Tashkin, and that's the original scleroderma lung study was really the first large prospective randomized trial to give us guidance in terms of which immunosuppressive agent worked in scleroderma patients. The scleroderma lung study 2 that's being presented here is basically looking at cyclophosphamide, which was that evidence-based treatment from the original study, and comparing it to mycophenolate, which is I think in some people's eyes a better tolerated agent in terms of immunosuppressives, and so it's going to be very exciting to see the results of that. One of the things that I'm most sensitive to, our simulation activities here and the hands-on learning that we have are tremendous learning opportunities. But hands-on skills are perishable unless you implement them in a thoughtful and systematic way. So one of the things that we ask people to do with many of the activities here, both simulation and our other interactive sessions, is a commitment to change, so that we can help them to identify the short list of things to prioritize when they come out of here and go back to the office. The nice thing here is we've got something for everybody, and so taking the latest and most up-to-date innovations, and bringing them back home and then sitting down with the office staff and their partners and sharing them, that's what CHEST is all about.